for animals to access. Mercy now plans to expand and diversify the garden to cater for local market demand. Ruzongoi, NTV.
All right, we're now ready to kickstart conversation that we promised you about water and the importance of water in the country, especially during this COVID-19 period, and why we should all play a part in paying our water bills. And this morning, to drive this conversation, I'm joined in studio by Anthony Ambugo. He's the CEO of the Water Services Providers Association. It's called WASPA. Welcome to the show.
Thank you very much.
All right. On the other side of the studio, we have Malesi Shivaji. He's the Executive Director of the Kenya Water and Sanitation Civil Society Network, that is KEWASNET. Welcome to the show.
Good morning.
All right. Let's just start here. Even before we talk about the bills and all that, the person who coined the phrase, water is life. Talk to us about the importance of actually all of us being able to access clean and safe water, especially at such a time.
Thank you very much. Water is very, very important, and its importance is captured in Article 43 of the Constitution, which now provides that every Kenyan citizen has a right of access to safe and clean water in adequate quantities. That is Section 43(1)(d). But up there, Part B also recognizes that every Kenyan has a right to reasonable standards of sanitation. Mm-hmm. This has been captured even at the international level under SDG 6. And these are nations which have committed. And under SDG 6, the importance of water is captured in terms of ensuring that there is universal access to affordable, potable water and safely managed sanitation within the Agenda 2030. Mm-hmm. So we are all aware that the globe is facing a pandemic, and there is global consensus that water, sanitation, and hygiene plays a very fundamental role in terms of protecting lives. And that is why we are insisting that you wash your hands as the first line of defense. Mm-hmm. Why are we saying that? You only use ordinary water because the virus we are talking about only can work inside. It's alive inside the host. But when it is outside, the lipid layer, when you wash with soap, you destroy the lipid layer and it disintegrates. So that one fast tracks in terms of immobilizing and killing the virus. And that is why we are insisting that it is very, very important.
Okay. But definitely water remains some sort of a limited resource. There has to be someone who brings the water to me. Sometimes it's government, sometimes it's an organization. And that's why we have to sort of pay these people who bring us the water. But sometimes we have situations where that bill is not paid, right?
Yes.
And now we actually have that situation even in amongst government agencies. You have a program or a campaign you called Government Pay Your Water Bills. Just talk to us briefly about that.
Okay, thank you very much. Now, in terms of provision of water services, there is a broad architectural framework in this country which was started way back with the Water Act 202, which has now transited to Water 2016. And the import of Water 2016, or why the Act was repealed, was to recognize the important function of county governments. When we promulgated our constitution, we came up in 2010 with the 2 levels of government. So in terms of water service provision, this is a constitutional function of the county governments. And water service providers, which I work for under the association, are agents. So the principal in terms of service provision is the county government. So WSPs are formed by dint of Article 77 of the Water Act, which provides the broad institutional framework. Mm-hmm. Now, when it comes to the payment of the government to pay your water bills, this is a campaign which is emanating because of the huge debt that has already been realized in terms of water service provision. We realize that apart from the government playing a role in water service provision, it is also a consumer of the same services. Mm-hmm. At the county level, you are talking about county agencies like hospitals, health centers, markets. At the national level, you are talking of the National Police Service, which are cascaded in various counties to ensure that services reach mwananchi. But still they are consumer of these services. So what we have seen over the years is that the debt has been accruing. And now you remember that last year, the government put measures, protocols, guidelines to ensure that we de-escalate, or we have containment of the virus. So one of these was to ensure that the taps do not become dry. And the government issued a moratorium to the WSPs that, one, there should be no disconnection of water services because of lack of payment of bills. Now, this is a very interesting behavior we have noted among us Kenyans, because when we were told that there is no disconnection, this was interpreted to mean that you don't pay your water bills. And we have seen it is a trend that somebody is reluctant to pay a water bill and still you see a plumber hovering around with a spanner. Then that is when you run to pay your water bills. So the import of that is that we had a significant drop in terms of revenue, and the revenue where the collection efficiency is around 97% dipped to 30%. So we are talking of an average of around 88 utilities serving the country, generating around 1.7 billion per month. And you realize that this is not even sufficient in the sector. 900 goes to salaries, and we have 250,000 for electricity, 200 million for chemicals, and another around 250 million for operation and maintenance.
Okay.
So this led to the struggling of utilities, and that is why we have partnered with KEWASNET now to plead and persuade government that if the institutions have to be sustainable, then the government, as one of the major consumer of services, should prioritize in terms of payment of bills. As we are talking about now, already with KEWASNET, we have already collected data in around 16 counties from 18 WSPs. But when we were looking at this during the pandemic, when it set in April last year, we realized that in entirety, the governments to both level owe the utilities around 2.1 billion. And 70% of this is owed by the county government agencies.
Okay. And at this point, let me just bring in Mr. Shivachi is the CEO of KEWASNET. Mr. Shivachi, at this point, I mean, the conversation is, we're talking about 2.1 billion shillings that is owed by state agencies and other government agencies, that is government agencies to this water utilities. But for me as a person, I pay my water bills every month. Why should I care? Why should it be my problem that the government didn't pay its bills to the water utilities?
Yeah, I think I would approach this, the answer to that question from the human right perspective, in which case we say that there are duties and there are responsibilities. And one of the responsibilities for every consumer is to make payment for the services received, including water supply. So when you make your payment for your water bills and the other consumer fails to make their payment, the result basically is that the service provider starts to struggle. And as my colleague CEO Mbuga has mentioned, when the moratorium was issued, it meant that the water service providers started to struggle much more in terms of the availability of resources to sustain services, to make sure that the taps do not run dry. So when the other consumer that is government or government institution fails to make payment, in essence it means that it is the normal consumer, the person, that then is sustaining that continued supply to themselves, but also to those other consumers who are not making payments. And we've seen that there are many reasons or excuses that are given with regards to non-payment of the bills, especially by the government institutions. But basically, what it means is that if you are making payments and the other consumer is not making payments, then the obligation shifts to that person who is making payments to provide services for the other non-paying consumer.
Okay, and you mentioned a bit about this being a very fundamental human right. So what we are saying is that if the government then doesn't pay this 2.1 billion shillings pending bills, in essence, sort of they are standing on the way of us achieving this or ensuring that this human right in regards to water is actually met.
Indeed. Non-payment of bills is basically one of the reasons why Kenyans are not able to achieve that fundamental right that is provided for within the Constitution. And indeed, I dare say that non-payment of bills is a primary source of the violation of the right to water and sanitation.
Okay, and just let me just bring it back to you then, Anthony, and because the nature of how a business operates is, if I continue paying my bills, you as the provider should continue improving my services. So tomorrow, if I was receiving water maybe once or twice a week, the fact that I've been paying on time, you should be able to improve the quality of the services that I receive, maybe even increase the frequency in which I get this water. Talk to us about the impact of this non-payment of these bills, especially in, you know, first of all, in terms of expansion of, let's say, access to this clean and very important resource, but also in terms of the quality.
Thank you very much. As I'd mentioned, I'll approach it from different angles, is that if you look at the architectural framework of the different institutions that are proposed in the Water Act 2016, you will realize that different institutions have different mandates. Specifically, the water service providers, if you look at their websites, you will find that their cardinal mandate is to provide water and sanitation services within their jurisdiction. So they will use words like to ensure that provide quality water to the delight of customers. All those words are there. And fundamentally, you will see that how this tariff is structured, because water is regulated, and that is why our water remains the cheapest available source of clean and safe water, because you can get a jerrycan of 20 liters between 2 shillings and 5 shillings. So that is how cheap it is. Now, when we are structuring the tariff, which involves the regulator and also this public participation, there are different segments of consumers. You have the domestic, the individuals, you have the government institutions, you have the schools, you have the kiosks, which we use to provide water in the informal settlements that have a more subsidized tariff. So what happens is that when you are doing that within your area of jurisdiction, now your tariff will be structured according to the number of consumers and the available water sources that are there, so that the regulator ensure the tariff is affordable. So the import of one player within these different segments of consumers not paying affects generally the entire utility. So that means if the company is even operating on a cost-reflective tariff and the costs are 2 million, and if there are government institutions which are not able to pay like 600,000, it means there is no money available for operation and maintenance. Basically, the utilities abstract water, treat, and that means you use chlorine, make it clean. Then you use electricity where you cannot afford gravity systems. So electricity is one major component. You have the human resource. So you will find that there is a challenge in meeting the operation.
But actually, let me just interrupt you, because the misconception sometimes is, I mean, it's just water, you're just getting it and piping it. People don't see the operational costs.
No, I think we would, I think with the Shivaji, we will have to do something. We will have to take people to the mechanics of ensuring that that water is safe and clean. You know, there are parameters of safety. Because as you have that water, you look at, I can give you River Chania, where thick abstract. The water is blood red. So what you have to do is you have to remove all the dirt that is inside. So it goes through a treatment process. You have sedimentation, you have to coagulate, you have to buy alum, you have to form flocks. They are very mechanical. Then you have to disinfect. So that entire process, then again you have to pump it. If you go to Garissa, they remove it from the river, they pump up. Then from there, they pump another 2 kilometers for treatment. After treatment, you pump to the high-rise tanks. So there are costs involved, and that is why we say we don't charge for water. It is the cost of ensuring the water is safe and clean. So what I'm trying to say is that all these costs that are involved, who bears them? Ultimately is the consumer. So when you have one consumer within that environment not paying, it affects the entire services, and that is why it brings sustainability problems. So the import of this, to answer your question, is that utilities now are facing a major crisis. Those ones who are pumping, especially Mombasa, is incurring 40 million per month, Nakuru 20 million per month, Nairobi the same. We now owe Kenya Power, because we had to trade in with government. When they told us that there's a moratorium now not for disconnection of water, we asked them also for a moratorium not for disconnection of power. But you see the bills were accumulating. So Kenya Power now requires 1 billion from the utilities. And now this is a bigger challenge. That is one part of it. Then there are also salary arrears. Most institutions were not paying gross. They were paying net. So you find that these has affected the morale of employees. If you want to go out, get a loan, you are told that your deductions have not been remitted. So the truth, this money is not with the utilities. It is with some, either a consumer or some government agency, which is still holding this money.
And I'm sure part of this problem and ballooning of this pending bills actually came through, as you mentioned earlier, during COVID-19. And I just want to bring in Mr. Shivachi at this point. Mr. Shivachi, Kenya, and I think more than 10 other African countries actually, during this COVID-19 period, gave directives that people should not have their water disconnected for unpaid bills, and that utility companies should not disconnect people from their water because they did not pay their bills. But there are unintended, consequences to that, right?
Yeah, indeed. And just to put a quick rider on that guidance, especially in Kenya, the government largely focused on those who are vulnerable, who were most exposed by the impacts of COVID-19, and basically the government sought to protect those at the lowest scale from basically not being able to access water during the crisis. But one of the effects was that even the large consumers, those who are able, who are less exposed or vulnerable to the vagaries of the COVID-19 or the economic impacts for that matter, ended up not paying. And therefore, the water service providers basically then started having accumulated bills. And as my colleague has mentioned, the general effect is that when you do not pay your bill and you are still getting supply, it's not that because government said you should not be disconnected, that the bill will stop accumulating. So eventually, and this is basically the message that no matter how long the crisis goes on, no matter how long the moratorium is in place, the bills will still have to be paid at one time or the other. So even at individual level or at institutional level, non-payment of bills is basically creating an individual crisis for the non-paying entity. And eventually it will result to either disconnection in a future date or disruption of critical services later. which is one of those key issues.
And when you talk about disconnection then, because the idea behind this moratorium was to make sure that we can all access this critical resource during this COVID-19, when we should all, make sure that we sanitize and wash our hands and we give sanitation the priority it deserves. But if we're talking about disconnections because the utility companies cannot sustain this unpaid bills, then we're basically rolling back on the gains we have made, because we are risking going back to a situation where no one actually can access this resource.
Indeed. As a civil society organization, I think we are caught up in a difficult situation regarding this particular context that you have brought out, because we stand out to speak on the human right to water and sanitation, and really for the continued supply of the resource to all Kenyans at all times in acceptable quality. But we also know, as I mentioned earlier, that the human rights to water comes with both the duties to the duty bearer, who is the supplier, but also the obligation by the rights holder or the one receiving the service. And therefore, as much as we would not advocate for disconnection, we would really like to see that there is the capacity for continued service provision by the water companies. And that is why we come here and basically say that even as we look back at the numbers, we can see that the water service providers have basically been able to collect to a larger proportion from individual consumers. But the institutional consumers, especially government, their bills seem to have continued to accumulate, and therefore if we are talking about disconnection, then we are saying it should not start with the individual or household consumers, but rather these institutional consumers who are holding a huge component of the debt to water service providers.
Let me actually hold you there, because Anthony mentioned earlier that most Kenyans, for them to pay for their bills, they must see you with a spanner threatening to disconnect or being coerced. Kenya Power comes and tells you, I'm switching off this power. But what happens when it's the government?
When it is the government, there are a number of options. But let me also say something about the Kenyan consumers. You know, that one was a ride down the moratorium. But we also want to thank the Kenyan consumers because they really supported us. We came to this station and told them, look here, utilities are not supported. The 200 shillings you pay is what is paying salaries, chemicals, and electricity. Kindly pay. If you don't pay, within the next few days, we will not be able to avail water. And we want to appreciate Kenyans. They had our call and they are paying, as my colleague has alluded to. We don't have a problem with them. But you see, when the government comes and pronounces, and there are some specific counties which were pronouncing that water is free, we did not have a problem with that, provided they ensure there is a mechanism that is put in place to ensure that power is paid. Because you can't use power without paying. You can't use chlorine without paying, and it is imported. And that by that time there was a problem because most countries were under lockdown. Chlorine comes from China and comes from India. So with the government, we have a number of options to approach. One is to disconnect. But look at it.
Can we disconnect a police station?
But look at it. Yeah, technically there are ways of disconnecting a police station. Of course, you won't go inside there. When you go inside there, they are holding guns and So there are so many ways, but we wouldn't approach. So you can follow a line that is outside there, then you throttle it a little bit. They see that water is reducing. Those are some of the tactics. Then with the time, there is no water, but they don't know where it has been disconnected. You can disconnect it from outside. But you see, these are not the available options we are looking at. What we are looking is service provision. It is a right. You have to get it. And that is why the first point is opening dialogue. Look at a hospital. How do you disconnect a hospital which needs water because the county government has not paid? You are doing some injustice because water is the driver of public health. You're talking about a public health. For you to attain universal access, then you must have access to safe and clean water in adequate quantities. So the situation here that would require some logic is to initiate some dialogue. And that is why we are here, just to spark dialogue. And not saying that alone, we also recognize that there are other counties where there are no debts. So it means it is possible. And we have realized, I think, when we'll be going around in some of the selected counties, we'll pick them as leading practices. If County A is getting resources from the same national government and it doesn't have bill with the utilities, then it is also possible. So it's a matter of prioritizing. So I think the best option that is available now is to open dialogue with specific government agencies and also county agencies for them to support utilities to ensure they have that operational autonomy. Because we are talking of sustainability. As much as we appreciate government, because we are talking now, the government has released 5.4 billion in terms of conditional liquidity support grant to the utilities to cushion them. So you see, this is good in the wake of pandemic, but this is not a continuous process. In terms of sustainability, it is important that we have commitments from government to pay their bills when they fall due.
Okay. And speaking of liquidity support, let's just take a look at this story where the World Bank has allocated the Ministry of Water, Sanitation and Irrigation some 6.9 billion shillings to implement a conditional liquidity support program to provide short-term liquidity to support water service providers. The funding is aimed at enabling the water service providers to maintain operations and service levels during the COVID-19 pandemic. The funding facility will be managed by the Water Sector Trust Fund and the Water Services Regulatory Board. The water service providers are expected to use the funds to finance maintenance requirements, pay for regulatory fees, and execute emergency interventions to mitigate COVID-19 where necessary.
Waterfront to date has received 75 water service providers information and has so far approved grant for a month of May to August. So once I get the go-ahead from my board tomorrow and also the nod from the ministry, we will start disbursing these funds right away.
So for starters, immediately after this, like I have alluded to, we'll have a caucus. My counterpart here, engineer, my team and I will have a quick consultation and we'll be able to agree on the next series of interventions. Number two, already approved a series of regional consultations and engagement with yourselves so that we don't always have to do things from headquarters. When we come to the regions, it is possible you'll be supporting us in intensifying what has become the new norm now of monitoring projects in terms of their performance, in terms of their status, in terms of gaps, and coming up with joint solutions.
Okay. Is that the kind of the support you were talking about?
This is what I'm talking about, because 5.4 billion is meant to cushion the utility in terms of operations. And these, as you see, I was there. This is what we have worked closely with government, because we went to them and said, fine, now that we have a moratorium, we have a fundamental duty of protecting lives, and we even had to install hand washing points in critical positions. So we had to go out of our way and handle even the hygiene component, providing soap and the rest. So we said with the moratorium now, the services are going down. The sustainability is threatened. How can you support utilities? And that is when the ministry now crafted a program and hived it under World Bank. Okay. And you can see that is what this is. So the 1.5 billion will be a fixed, that will be a loan, but the grant that is to cushion the utilities. So we are saying this is a temporary reprieve because we don't know how long the pandemic will be with us. But what we appreciate is that at least customers are paying. But now we implore the national government should come in, apart from that support, which is temporary, because this is supposed to take care of the months of May up to December, that for 5.4 billion. But you can see already we are under a lockdown again in the 5 counties. because of the escalation of the virus, and we want to de-escalate it. So it means we have to continue with the protocols, the guidelines, and that one requires funds.
Okay.
And that is why our passionate appeal to government institutions, because there is time value for money. What 1 million can do today, you will find it cannot do in the next 1 week because of the time value. So a shilling today is more important than a shilling received in 3 or 4 days.
Okay. And remember, we asked you to be part of this conversation on social media. We asked you on our question of the day this morning, what has been your biggest challenge in trying to access clean water in your community? Once again, what has been your biggest challenge in accessing clean water in your community? And I think some of you have been responding. Let's just try and see. Ismail, it says, in Mandera West, our biggest challenge is the contractors who are given task by the government to connect water and drill a borehole. They do shadow works, and community always struggles to get clean water. Thank you, Ismail from Mandera West. We have David Ngure. He says, Kibera illegal connections affecting the whole of Langata. Thank you, David Ngure. Of course, we'll ask our panelists to respond to that issue of illegal connections. All right, and then we have Robert Kiatu. He says, pipes passing through open sewer lines, mostly within our slums, of course. Right, thank you. And Flora Koroi, she says, at Murera in Kiambu, we have never accessed water since February 2nd. And what really water does is to send us the bill of 410 shillings every month. I get worried because if you ask them, they say water is not enough. Thank you, Florence Koroi. Let me just start with Mr. Shivachi. Could you kindly please respond to some of those comments you've seen with regards to the challenges that Kenyans have in accessing clean and safe water?
Yeah, I think when we talk about some of the challenges that have been clearly raised by Kenyans, I think one of them is largely on the issue of quality. The interaction between clean water pipes and sewage lines. But I would like to quickly say that largely most of those which is connected to the other question are as a result of illegal connections. It's very unlikely that a formal water service provider would channel a clean water pipe through a sewer line. So most of the time when that happens, and we've seen it especially in the informal settlements, it's as a result largely of illegal connections. And I would like to say that I applaud the NMS, especially in Nairobi, for some of the initiatives that they have brought in place to counter this. One of the things that NMS is applying, especially in the informal settlements in Kibera, in Kibra, has been using overpass pipes and connections, so that it is all visible to everyone where the pipe is passing through, and you cannot have, the underground illegal connections that have plagued the system for so long. In that sense, then you are almost assured of consistency of supply, fairness in terms of distribution, but also a protection from that interaction between clean water pipe and sewer lines. I think that has been one of the key improvements. But indeed, we are still having a huge challenge in terms of the issue of quality, in terms of issues of interaction between clean water pipes and sewer lines, especially in informal settlements.
Okay, and I'm sure you can see the pictures on our screens right now of people fetching water, from those water trucks and also the mkokotenis on your screen right now. And this reminds me of another problem that we've had for quite some time, people talking of what they would call cartels who intentionally disconnect or block access to water so that they can actually sell to the residents of that particular area.
Yeah, at KaosNet we actually say that whenever you see a cart, a donkey cart carrying water, or any person or those lines of communities trying to access water in jerry cans. That is an example of poor governance in the water sector. It basically shows you that the system is failing to deliver. The aspiration of the Sustainable Development Goals for water assumes that there is going to be distribution of water to the homesteads. So when you are having individuals coming in to interrupt the system, it means that the governance structure is failing to control these cartels, these individuals that basically interrupt the system and hike the prices. Because normally when you look at the cost of a jerry can of water, it can go as high as 50 shillings. Yet the person who receives it at the homestead through the tap gets it for, on average, less than a shilling for the jerry can. So you see, it ends up being that it is the poor person who is not getting access that is paying much more.
Okay.
And therefore, it's a governance problem that we need to deal with.
All right. And maybe back to you, Anthony, then. So we all agree 2.1 billion shillings is a huge figure, that is in terms of what is what the county governments owe to water utilities. But some of those are very important key government institutions that cannot be disconnected with, their water cannot be disconnected. And even the people themselves, we are living in a COVID-19 period where we cannot afford to disconnect people from water. So how do we move this forward?
I don't know if you'll allow me to weigh in on
Yes,
the question
please.
before. Now, the one problem that we have in this country, we have to appreciate that we are a water scarce country. According to the UN thresholds, we are supposed to have 1,000 cubic meters per capita per person. But what we are talking now is around 452 meter cubed per capita. So if you compare ourselves to Tanzania, Uganda, and Ethiopia, you find that we are below.
We are much worse.
We are much worse. Now, when it comes in terms of water and sanitation coverage, water coverage in this country is at 59%. I'm now told the new figures is at 63%. So it means that we don't have adequate infrastructure to provide every citizen of this country with water. So it means that when water is accessible, it means from your dwelling place to and fro, you should not take more than 30 minutes. So if you are able to access that water within 30 minutes, that is the definition of accessibility.
Okay.
So it is not accessible. So what we are saying is that the water service providers only serve a population of 23.7 million. But still within that service provision, we have around 9 million who are not served. And who are these who are not served? These are the people in the informal settlement, the vulnerable people. The people in Mukuru, the people in Kawangware, the people in Obunga in Kisumu, the people in Nyagacho in Kericho. Those are informal settlements that I'm mentioning. So, and that is why the government also said that we provide water for free. That is why you are seeing the trucks. So, we would not blame these people 100% because they also play complementary effort. When you see somebody vending in a mkokoteni, what is the thing? It means that that utility there does not have sufficient or adequate water to supply everybody.
Okay, and just maybe there, because the issue I was raising was there are situations, of course, where there is actually no piped water in the place.
Yes.
But there are situations where there is actually piped water. The water can be availed. But we have people who have, as they call them, cartels, which they say illegally, let's say, block the pipes of water service providers so that they can sell. And he mentioned that I think a jerry can goes for, was it 20 shillings or 50 shillings?
Yes. Now, what we have said, and it's very clear, the regulator has provided a way of how you deal with illegal connections. Now, it's upon the utility to ensure it creates mechanism to ensure that nobody is out there. It is better to have them in, not disconnected, and negotiate. Even if you find them, there are mechanisms. Because if they are stealing water, bring them back, penalize them, and let them continue accessing that water instead of leaving them out. So there is an approach that utilities have developed because I was an MD for 6 years and that is what we were doing. So if the guy is stealing water and the line is there, so you just need to negotiate with the guy,
instead of destroying infrastructure.
Now, the other thing is that also the members of the public play a fundamental role.
Yeah.
If your wife and your children are going to fetch water somewhere, and this guy is disconnected, but he never goes out, but you never tell the utility. So it is difficult to know. So they also have a responsibility of reporting illegal connections.
Okay.
And I can tell you our utilities respond because this is the cause of what we call non-revenue water, which is also at 43%. So we lose almost half of what we produce. And some of this is because of the illegal connections.
Okay.
So I think utilities have created non-revenue water units to address this by day. Okay. And the incentives where you are able to report an illegal connection, you find there is also a monetary incentive to unearth this. So it is a challenge that is confronting us as a nation. And as Sivachi said, my colleague, is a governance issue. These are issues of integrity because you find it is colluded because it cannot be done without knowledge of certain people.
Okay.
And that is something that we encourage our consumers and customers to bring to our attention.
I like
the other issue of Kiambu, it's Ruiru Julia, I've seen, is they can go to the office because if it's a dry line for one reason or another, was handling one for Kilifi, is that you will not be billed. They need to adjust. Then they'll give you maybe a time frame where they should be able to provide water. So we have to appreciate scarcity of water if it is not there. Okay. Because we have also population explosion, especially in the urban areas. You find there is a line which was serving maybe 10 customers because there was no proper planning. So in that area, then you find now there are 100 customers. So it may not be sufficient. Some will miss.
Okay. And let me just bring in Shivachi. Shivachi, because most of those people, as you mentioned, are in informal settlements. And even if they are not in informal settlements, we are definitely all at a point where we need to have our water connection to stay, connected. So how do we ensure compliance without necessarily disconnecting people from this resource?
I think it is a matter of dialogue, as my colleague has mentioned, that you really start to have conversations with those who are not making payments. And especially when you are looking at government institutions, I think it is very important to understand what is the source of the non-payment. And in our conversations with the service providers, we have discovered that there are various reasons and therefore various solutions. And one of the key sources of this non-payment is because there is historical debt. So, for example, at the conception of the county governments, there was succession from the municipal councils, which already had debt. Now, some of this debt still stands to debt. That what was owed by municipal councils, by county councils, has not been paid, and many of the county governments are saying, we are not the ones who incurred this debt, and therefore we should not be subjected to this. Then, of course, as my colleague mentioned, there are those critical service institutions like hospitals, which there is a humanitarian context of what happens when you disconnect such an institution. So there needs to be conversations, but I think the bigger picture needs to be looked at in terms of what is the impact of non-payment or continued supply with non-payment to these institutions. And in some cases, the disconnection has to happen as a prompt to create payment.
All right, but also on the bit about, I mean, there has to be an element of how the messaging is done, so that when we say we don't want anyone to be disconnected from water because we are fighting COVID-19, it doesn't translate to don't pay your water bills.
I think that was clear in the guidance given by the Ministry of Water and Sanitation at the time, that basically this was a moratorium created to protect the lowest in the community, those who are most exposed, those who are most vulnerable at the time. This was not a blanket guidance to the service providers, and I don't think, and my CEO colleague would correct me if I'm wrong, that this was I don't think it was a blanket provision for non-disconnection of all suppliers. I think it was really targeted to those who are most at risk.
Okay. And maybe back to you, Anthony, you mentioned earlier that what you received was it 5.9 billion shillings?
It's 5.4.
Okay. But that's going to run out after some time.
Yes, because that is intended to cover the period, that is last year, between May to December, to cushion the utilities, because it's a conditional grant, and data was collected from the utilities on how, because we had COVID collection efficiency. Because if you had balkanized already the area of jurisdiction of a utility, so this group of customers are paying, these are not paying. And remember, that is when we deployed the water boozers, because we were now to provide tooth and nail. The informal settlements were to get water, because these were the hotspots. There is no water. So one is to ensure a boozer is there. And we deployed around 93 boozers. And you've seen even the Nairobi Metropolitan Service doing that. And it's very expensive, because you are carrying water which is about maybe 1,000 shillings. It is maybe 6 cubic meters. We sell it at 200. But the vehicle itself is around 6 million. And the cost of fuel is around maybe 2,000. So you see, it is a very expensive affair. So that was temporarily to do that, to ensure that you protect lives. And we realized that the cost of serving the informal settlement was around 300 million. So you can see that there is already 300 million leakage in terms of what you are saying, free to the vulnerable. But this is not sustainable. But what we think is that part of that conditional grant that has come is to take care of the informal settlement. But as we move forward, it is important now that both the levels of government, as they are, we know there are very huge infrastructural development. You can talk of the Itare Dam, Mwache Dam, all those. But you can see like Itare Dam has already stalled, so you don't know when you will have that water. For Nairobi, we are talking of the Northern Water Collector Tunnel. So these are government projects, huge government projects that are supposed to bridge the deficit in terms of water. So ours, once the projects are complete, they are handed to, like the Northern Water Collector will now be handed to Nairobi Water to increase water in Nairobi.
But speaking about sustainability, it also comes to the issue of these funds and the sustainability, because we can't keep getting grants from the World Bank or the government. Eventually, even after COVID, we need to go back to this very same issue of unpaid water bills. And he actually correctly mentioned that this is something that has existed even in the days of the municipal councils. So what is the sustainable way to move forward and ensure that, you know, these agencies can start honoring, you know, their obligations?
So I think the first way move forward is opening a conversation with the respective government institutions. And again, what I can say here clearly, because that is only one part of the coin, even from the county government's perspective, because now constitutionally they are the ones with the mandate to ensure that every citizen within their counties have access to water. So one thing that we have seen, most of the utilities do not have cost-reflective tariffs. It means the money they collect is not sufficient to provide the service. They're always on grants. So it behoves them also to support the utilities to have cost-reflective tariffs. Tariffs that are able to sustain service provision, so that you don't have a utility which is down because it is disconnected. You know, when the utility is disconnected because of electricity, because the tariff is low or one consumer has not paid, even the consumer that has paid the bill suffers.
All right.
So payment of bills and also supporting the operational autonomy. And this one is specifically to county government. Some of them, some have really supported. If you look at Nyeri, Nyeri is doing very well. There are a number of companies that we can mention in the country that are doing very well. Because they also have cost-reflective tariffs, and the county governments are supporting them.
All right. Gentlemen, I have to get your closing comments. But just before we do that, let's see if we can get some more feedback. Can we? All right, do we have? All right, let's just then close it from here, because I think our time is running out. We have in a minute and 30 seconds, let me just start with Shivaji. In a minute and 30 seconds, how do we move this conversation forward? And I know he has already mentioned the issue of opening dialogue, but sometimes it may not work.
I think my closing message would basically to go back and inform government that this is a human rights issue. Government has an obligation to fulfill, to observe and to protect the rights to water and sanitation, and it does not matter which agency of government is failing to deliver on its bills. The moment non-payment is figured out as a source of non-fulfillment of the right to water, then government will be held liable for that. And one time this will become a very critical issue even in the corridors of justice in this country. And therefore, to avoid that, it would be very critical that agencies that have overdue bills make sure that they fulfill their obligations, because at the moment, the biggest financier, because you asked this question earlier, the biggest financier in the water sector is through payment of bills. And therefore, if any actor is not making that payment, it means then there is a disruption in that supply, and therefore the disruption in the achievement of the aspirations of the human right to water in Kenya.
All right. Thank you, Mr. Shivaji. And maybe to you, Anthony, then in your closing remarks, because he's mentioned the issue of human rights quite a while. And earlier on, we had the issue of how, we are behind our peers, including Uganda and Tanzania, in terms of access to these resources. Just talk to us about the way forward for the situation, and also keeping in mind that we need to ensure that a huge percentage of Kenyans who cannot access clean and safe water at this point should be able to do so, considering it is a human right, both in our constitution and in international law.
What I can say is that fundamentally everybody plays a very big role in terms within the water space, right from the consumer up to the government. And under Article 10 of the Constitution, we are talking about sustainable development when any public officer is undertaking any responsibility. So it is very, very important that as we are discharging our duties at both levels of government, taking note that the first line of defense, and I think fundamentally as utilities we were forgotten until we had to make a shout. Before, because we are saying protecting the vulnerable communities. What is the first line of defense is to ensure there is access to water. When they go to hospital, it means the first line of defense has been breached. So it's curative. So we are talking of preventive. So here we are talking of, we play a very important role in terms of preventive healthcare, protecting lives, especially during infectious diseases and during the pandemics. So what we are pleading with both levels of government, mulipe madeni yenu sasa. Na kama si sasa, tunaomba mulipe sasa hivi.
All right, Anthony, what a wonderful closing message. Mulipe madeni yenu sasa, na kama si sasa, ni sasa hivi. Many thanks, Anthony Ambogo is the CEO of the Water Services Providers Association, that is WASPA, and also Malesi Shivaji Samson is the CEO of the Kenya Water and Sanitation Civil Society Network, that is KEWASNET. This conversation has been about you and also the government paying your water bills. We go for a quick break, but at the other end of this very short break, remember it is World Health Day, and we have a very interesting panel that should be coming to us to talk to us about how we can bridge yet another gap, not about water, but this time about access to healthcare.